Schizophrenia. Historically, mental illnesses were not understood well. Illnesses like schizophrenia were grouped in with other illnesses since there was not much information on it. People viewed these illnesses as having a supernatural origin. It was believed that conditions that affected a human's mind were caused by evil spirits, demon possessions, punishment, and other spiritual ideas. Unlike today, treatments for illnesses like schizophrenia often take place as an exorcism or trepanation. Trepanation was a procedure where the patient would have holes drilled into their skull. Over time, the practice of trepanation was discontinued, but for hundreds and thousands of years, schizophrenia has been seen as a moral and spiritual problem. Schizophrenia was first diagnosed in 1887 under the name of dementia praecox. Dr. Emil Kraepelin made the diagnosis by differentiating it from dementia that occurs later in life. The term schizophrenia was not coined until 1911 by a Swiss psychiatrist known as Eugen Buehler. Both Kraepelin and Buehler had clustered different symptoms of schizophrenia into distinct categories. However, Buehler was the one who recognized different symptoms of schizophrenia as either positive or negative. These categories are continued being used today: paranoid, disorganized, catatonic, residual, and undifferentiated subtypes are all types of schizophrenia based on particular clusters of symptoms. A Beautiful Mind is a movie based on the life of famous mathematician John Forbes Nash Jr. John Nash had been diagnosed with paranoid schizophrenia in his late 20s. The film begins as John Nash is entering graduate school at Princeton University to study mathematics. As the movie progresses, the early symptoms of schizophrenia become more apparent. The viewer does not realize until later in the film that most of what was shown are hallucinations pertaining to John Nash's schizophrenia. In the film, John Nash was asked to decrypt decoded communications from Russia at the Pentagon. He gained the attention of a man named William Parcher, an agent in the Department of Defense, and is approached to join a group of individuals that scan newspapers and magazines to find hidden Russian codes. Nash is told to leave the decoded messages in a secret Dropbox. After getting into a gun battle between Parcher and Russian agents, Nash requests to be relieved from his job. Parcher tells the man that if he were to do that, then he would have to be killed. At Harvard, Nash is giving a lecture when he sees his roommate from college, Charles, and the Russian agents. This results in him fleeing. John Nash is sent to a psychiatric hospital soon after, where he is placed under the care of Dr. Rosen. Dr. Rosen tells Nash's wife, Alicia, that Nash suffers from schizophrenia. Alicia is not fully convinced until she enters Nash's office, where she sees a cluster of papers everywhere and finds the secret Dropbox that has unopened, decoded messages. It is learned that Parcher and his roommate Charles exist only in John Nash's mind. Nash remains in the psychiatric hospital and receives a series of insulin shock therapy treatments. These sessions are incredibly painful for the patient. Nash is laid down on a hospital bed, and his arms and legs are strapped to the bed. He is then injected with insulin and is administered shocks. He has to undergo this 5 times a week for 10 weeks. Nash is released as long as he intends to take his antipsychotic meds.
Administering insulin. How often?
5 times a week for 10 weeks.
Upon dealing with the negative side effects, he stops taking his medication, which causes a relapse in his psychosis. He leaves his son in the bath due to the belief that Charles is watching him, resulting in almost killing him. Alicia manages to save the child in time and goes to call the psychiatric hospital. She is unable to do that and flees the house with the child. However, Nash stands in front of her car to prevent her from leaving. It is only then John Nash comes to the realization that the people are a figment of his hallucination. and he ends up saying a tearful goodbye to them. The film concludes with Nash growing older and beginning to work out of the library and audit classes at Princeton University. Nash continues to have some hallucinations, but checks that new acquaintances are real people and is able to live with his psychotic episodes. Eventually, Nash begins to teach again and soon wins the Nobel Memorial Prize in Economics for his work on game theory. One of the biggest changes the movie had compared to John Nash's real-life experience was the portrayal of hallucinations. John Nash had auditory hallucinations and possible delusions, but he never had visual hallucinations. The film used the visual hallucinations as a way for the audience to understand what Nash was going through. However, the hallucinations depicted in the film are over-exaggerated. In the film, John Nash is driven to a place by William Parcher. However, once it is learned that Parcher is only in Nash's mind, it raises the question of how Nash actually was driven around. Hallucinations are just figments of imagination that are real to the people dealing with it, but they are unable to actually perform actions like driving. Nash's visual hallucinations in the movie can cause a fear in the audience of people watching the film because they can believe that hallucinations have the power to physically perform certain actions. Those with paranoid schizophrenia are unreasonably suspicious of other people, making it hard for them to function with everyday things. Medications and help can stop symptoms or make them easier to deal with, but the illness will be lifelong. Paranoid schizophrenics have delusions that seem real, and the beliefs can be reflections of fear and anxiety. Schizophrenics are typically not violent, but delusions can make them feel angry or even threatened, so those around them should proceed with caution. Those with schizophrenia should be treated like a human being and should not be treated as a bomb ready to explode. That sort of treatment can cause them to go over the edge. The film A Beautiful Mind is an important film in showing viewers how mental illnesses like schizophrenia can affect a person's life. However, viewers should remain cautious in using movies as their only source of information. Schizophrenia is still being researched heavily, and the diagnosis and treatment of the illness is always changing. In order to help those plagued by the illness, people should learn more information and try to create a safe and welcoming environment.